Hey everybody, welcome back to Die Time. Same time. We're catching up with Dr. Guy Bahar of the Posture Clinic, as well as Carrie Kozarok, who is a client with the Posture Clinic. Welcome to the show, folks.
Thanks for having us.
Great to have you both.
A pleasure to have you here. Dr. Guy Bahar, I'm going to start with you because we always hear about FHP, forward head posture, when you come onto the show. For people at home who haven't seen a segment before, what exactly is forward head posture?
Okay, forward head posture is a simple way of explaining a phenomenon that's growing in the North America specifically, where people who use computers or are hunching forward are acquiring a posture that's causing their heads to jet up more and more forward, and that's causing their shoulders to round, their upper back to bend forward, and their chest to sort of sag.
Can it cause? I was going to say, can it cause other things in the body because your spine is not aligned?
Absolutely, because it's causing constant compression on the nerves. It's going to affect a myriad of things, from pains in the shoulders to compressing on nerves that influence things like headaches, and also your organs. So your breathing's going to get affected, your heart's going to get affected.
Wow. And Carrie, I mean, you know firsthand how troublesome this can be. Can you take us back to when you sort of were diagnosed with this and realized it was, you know, an actual problem?
Well, I came to the whole posture and the chiropractic scene really the same way a lot of people do, because I had headaches and neck pain and tension across the top of my shoulders. And when I saw what my posture number was, and when Dr. Bahar explained to me what the impact of all of these things were on my health, I began treatment. And my main interest at that time was in the headaches, because it was a constant problem. And what happened as a result of that, after getting, you know, that taken care of, was, of course, the headaches went away, which was fabulous. But I started to notice, I don't know about everybody else, but when I catch myself in like a home movie or a family video or something, and be like, what am I standing like that for? Like, what is that? And I thought, oh, that's so awful looking. I hated the way it looked. Never put the two things together. And then I started to notice, you know, wow, and so when I got my after posture number down, I couldn't help but notice the way it looked and how I looked now. And people were asking me, did you lose weight, or did you? So one person asked me if I had a boob lift.
Oh my goodness.
If you look at the pictures, it makes
absolutely
shocking what a difference it makes.
And you mentioned the posture number. Can you sort of explain what that is?
Posture number is a system that we have. It's a software program actually that'll actually numerically quantify the amount of deviation. So if a person has good alignment and proper straight posture, there won't be any angles in their body. Their ear will line up straight with their shoulder, which will line up with their hip, which will line up with their knee. Zero number. Every deviation will cause more angles. So the more forward the head position, the greater the number is going to be. So it's a simple way that people can appreciate the progress as we measure them.
I feel my head over in like a 26 right now. We have a couple pictures that I want to get to that showcases also the number strategy, right?
Yeah.
Let's take a look at some of those right now. So what is this we're looking at?
Okay, so here we see a child who's texting, and you know, our kids are going to be texting a lot and going to be using iPads and their laptops, and it's going to be putting their bodies, we see in the middle shot, in a very Jeopardy type of position, and you can see how far forward the head is being carried over the body, and it's causing a lot of rounding in the shoulders, and especially at the neck we can see a humping type of thing. So afterwards we can also see the effect that has. So the number gets quite a bit higher on the far left shot.
Here it is too over here. So wow, that just shows you the differences between your normal posture and how
you don't even think about it.
How bad it can get, really, without
From an appearance
noticing.
perspective, like if you look at, the picture's gone, but if you look at the very first picture, you can see that, you know, the shoulders are back and the tummy is in and the boobs are up and the tush looks nice. But in the it's really the reverse. But in this picture, you can see that there's, you know, there's a rounding, there's a sagging in the breasts, a big rounding here, which it gives the appearance of a lot of extra body weight.
Pushes the stomach out too, right?
Yeah, a lot. Like you can see in this picture, I mean, she's a slim girl, and yet this is how it looks when your posture is poor. Has a huge impact. Like, people are so worried about losing weight and improving their appearance in so many ways, and this is a really amazing way to have such a significant impact, because she doesn't just look better, she looks more confident, she looks happier and more energized.
We'll bring up the next picture as well, and you're right. When it comes to looking at these pictures, the one that has the correct posture looks confident.
Well, this is Carrie right here.
This is you, Carrie.
Yeah.
So before your number was 22.
Yeah.
And now you're a 20. You're not. Now you're a 5.
Yeah.
Okay.
And you can see, you know what,
Wow.
it does look like you got a boob lift. I mean, I'm
It
just-
looks like
right?
I had a boob lift, and it looks
It
like I
changes
lost
everything,
10
yeah.
pounds.
Oh my
like
goodness.
that's what I can't get
Yeah,
over
and
is
that-
right in there.
And
It's
in this-
such a
and
difference
in
in
this time frame, there was absolutely no weight loss.
So let me ask you about the time frame, because people
That's incredible.
who are watching this, Carrie was at a 22, she's now at a 5. I mean, what is the
Yeah.
time length from 22 to 5?
It will vary enormously with individuals. You have
Sure.
to look at lifestyle, you have to look at the age, their history of any kind of injuries, people in car accidents, people who've had degeneration. Obviously, it's going to take a big time, but I've seen miraculous changes in as little as 6 weeks.
Really?
And some of them can take up to a year, but the range can be, the key thing to any kind of corrective process, as you know, whether it's with weight loss or working out, is consistency.
Yeah.
And when we see consistent commitment of time, we're training the body to a configuration that becomes more natural and more easy to maintain. And once you do that, the same way braces are worn on crooked teeth, over time, the body just follows that
Yeah.
pattern and doesn't know from anything else.
And Carrie, for you, how has this changed your life? I mean, it must have done wonders for you.
You know what? When you have pain and you have headaches like 3-4 times a week, your whole life, when they go away, it's
Yeah.
like, oh.
It's almost like you're forgetting something, right? You're like, something should be hurting right now.
It's
I
what
feel
you're
good
forgetting
after
is
all.
that bottle of Tylenol at home because you don't carry stuff like that anymore.
Oh.
It's a remarkable thing.
Thank you so much to both of you. And if you'd like to find your posture number and hopefully get it to a good point in your life, you can go to the website postureclinic.ca. We'll be right back.
I gotta come.